Hello, everyone. Thank you and welcome to today's Health and Wellness webinar presented by Franciscan Health. We have a few more people joining us today, so we will start here in a few minutes. All right. Hello, everyone. We'll go ahead and get started for today. Thank you for participating in the Virtual Corporate Challenge presented by Elevance Health. My name is Patrick Corbett, and I'm happy to welcome you to today's Health and Wellness webinar presented by Franciscan Health. I would love for everyone to introduce themselves in the chat by sharing your name and company. We want to know who is joining us today. We also encourage you to ask any questions you may have during today's presentation using the Q&A function. We'll save some time at the end to cover any questions we receive. Indiana Sports Corp has hosted the Corporate Challenge for more than 25 years, and what we love most about the event is how it allows us to connect with companies throughout the community. This supports our mission to create positive impact by hosting world-class sporting events, which drive economic vitality, facilitate a vibrant community with civic pride, garner national and international media attention, and create opportunities for our youth. We have tons of ways to get involved with these events and with our mission through membership and volunteering. Don't forget that volunteering for Corporate Challenge earns points towards your company's total. For additional info about our mission or to sign up as a volunteer, go to indianasportscorp.org and follow us on social. I'll put that link in the chat now so you can learn more about our organization after today's webinar. This year's virtual corporate challenge would not have been possible without the tremendous support of our corporate partners. In addition to Elevance Health, I'd like to thank our corporate champion sponsors: Franciscan Health, Group 1001, Indiana Farm Bureau Insurance, Indianapolis Motor Speedway, Lucas Oil, and NCAA, Republic Airways, Zimmer Biomet, as well as our associate and on-site sponsors. Before I introduce today's guest speaker, let's see a couple of videos from our sponsors.
Caitlin Clark, amazing at assists. Gainbridge, the ultimate assist for your savings. But ever since they teamed up, she's taken assisting to a whole new level. Caitlin Clark, graded assists. Gainbridge, graded assists for your savings.
The NCAA, driving change to do more for today's student athletes. The NCAA programs deliver $4 billion in scholarships every year. Those D1 scholarships are now guaranteed. Health and well-being services are mandatory. Student athletes get tutoring as well as financial literacy coaching because almost everyone is going pro in something other than sports. The NCAA, driving change to do more for today's student athletes.
Whether you want to fly more, lead more, train more, learn more, or teach more, the more you want to achieve, the more support you'll need, which is what you'll find when you land at Republic. Republic Airways, welcome aboard.
All right, and with that, it's my pleasure to introduce Dr. Joseph Richardville, who will lead today's session. Dr. Richardville is a sports medicine specialist with Franciscan Health. Dr. Richardville specializes in diagnosing and treating several non-surgical musculoskeletal injuries. He completed his residency in family medicine and his fellowship in sports medicine. In addition to seeing patients in the clinic, Dr. Richardville is also a team physician for the Indianapolis Indians and Butler University. And now, the moment you've been waiting for, hailing from Indianapolis, Indiana, weighing in at a whopping 185 pounds, the MD on the street, the doc that rocks. Ladies and gentlemen, Dr. Joe Richardville.
All right, welcome everybody. Good afternoon. Thank you to Indiana Sports Corp for putting this on, and thank you to all of you guys for participating here. So let me share my screen. Let's see, I'm not able to do that. Is that working? Nope, that's not right. Sorry.
It looks good.
I think is can you share my screen here? You guys can see the updated PowerPoint?
Yeah, we can see your PowerPoint.
Okay. All right. Well, welcome everybody. Like I said, thanks for your participation today. We're going to be talking about exercise programs and injury prevention. So, all right. So first of all, and you guys can now see the slide with the orangutan. Is that correct?
No.
No. Okay. Yeah, it's not. Let's see here. I think it's just pulled up the old slide set, which I do not.
If you click share and then share the window again.
The window here. All right. Can you now see? How about now?
No, it's just a black screen there.
All right. All right, I'm going to stop sharing for a second. And then, where is my screen? Okay. And how about now? Can you see my screen?
Yeah.
Perfect. All right, I apologize for that. Okay, so welcome. So we're going to talk about exercise programs and injury prevention. Now, this is a topic that probably a lot of people have heard over time, so it can be kind of a tedious topic, boring, so hopefully we try and get some energy going and get everybody involved. So let's get into it. So let's talk about exercise. Exercise kind of sucks, right? Like, it's hard, it hurts, it takes some time. So a lot of us don't really see reason to do it. So why do it? You know, it's just not that much fun. What's the motivation? Do we want to be like our heroes? Young Joe was really captivated with the Rocky movies. That's why I came out like that. That's what motivated me as a young person. But some of those kind of external motivators don't always keep us motivated long term. You know, do we do it because someone tells us? Do we do it just because it's part of our job? Do we do it for fun? But I really say when you do it because you really want to be a better version of yourself, that's when it really can have that lasting motivation to continue to exercise. And you might say, hey, exercise is tough. Like we said, exercise kind of stinks. You know, I'm not a very athletic person. I'm not a very physical person. But really, anybody who participates in physical activity for self-betterment is an athlete. So I want you to take that message and feel empowered to say, hey, I can do this. Any physical activity you do for self-betterment is exercise. And that's going to really give you some improvements in energy, reduce pain, and can really be fun. So feel empowered. You are an athlete. You can do it. And again, the goal is simply just self-betterment. It's about improving a lot of the facets of our lives, the social, physical, emotional improvements. It shouldn't be about appearance or vanity. It's not about comparing yourself to other people. It's not about being better than anyone else. It's just about being a better version of yourself. So looking inside you, trying to find that superhero that you have. What does exercise prevent? A lot of stuff. Exercise prevents all-cause mortality. Like, so you will live longer and be healthier. It prevents all sorts of heart disease, all sorts of metabolic disease, even certain cancers. So, I mean, there's so many medical benefits, proven medical benefits to exercise that, I mean, it's clear. This is the boring stuff. You guys know this. This has probably been told you a million times. What else does it do? It helps improve strength. It helps improve confidence, cognitive function, sleep quality, all of these things that really make a big difference in our lives. So again, stuff that I'm sure you've heard a million times over. So now that you've, heard again why exercise can be beneficial, what are some of the reasons that we don't exercise? What are some of the excuses that we come up with? What are the barriers that we all face? Time is a big one. Access to resources such as equipment, memberships, financial constraints in exercising, fatigue, pain, just not feeling motivated from an enjoyment standpoint, or really not feeling motivated from seeing the benefit of it. So lots of different reasons why people don't exercise. Let's talk about some of those. So, like, how do we overcome some of those barriers? Some of the biggest barrier is time convenience. A lot of people are very, very busy. Exercise takes time. Exercise, sometimes you got to go out of your way for that. But I want to assure you that really any time spent being physically active is beneficial. Even very small bouts of activity scattered throughout the day. It doesn't have to be, go to the gym for an hour. Sometimes we call these exercise snacks. Things like parking farther away, and so walking more across the parking lot, or going for a short walk, or walking when you can, taking the stairs. A lot of people have standing desks. These types of little ways to incorporate more physical activity into your daily routine. A lot of times that can overcome some of this time and convenience burden. Other things, utilize the resources that are convenient to you. The gyms or the parks that are close by to home, to work, or along your commute. Those things can all be great resources to you. The best exercise is the exercise that you will do, so make it easy, make it convenient. When we talk about fatigue and boredom, endurance, I mean, I get it. We're all tired. We all work really hard, and so we can be pretty exhausted at the end of the day. But endurance is one of those trainable qualities. The more energy that you kind of expend in a controlled way, the more energy that you build that endurance, and that actually improves sleep, and you can actually get better energy that way. And then there are so many ways to exercise. There should be a fun activity that you can enjoy with friends or on your own. Different ways to keep it fun is to set goals, challenge yourself. And there's certainly lots of social opportunities for exercise, a group with friends, family, those types of group activities. So. Then as far as the financial aspects of exercise, a lot of times there are financial incentives for employee health programs. You get decreased insurance premiums. A lot of times they're offered free or at least discounted gym memberships. A lot of places even have a gym on site. For the numbers folks there, really, there's an estimated $117 billion spent per year in healthcare due to inactivity. So conditions or injuries or other types of illnesses that could have probably been prevented by just some regular exercise, costing us quite a bit. And then even personal healthcare costs can be reduced around 5% annually with physical activity. A lot of times I would talk to some patients or friends and say, hey, listen, people end up investing time and money in their health one way or another. You can either do it kind of up front and take control of that, or you can do it on the back end when you're not feeling so well. So it really is a financial cost saver to exercise from a healthcare expenditure standpoint. So now that I've explained why all of your excuses are no good, I'm just kidding, but the next daunting task is to develop an exercise routine. If you're not already in a routine, it can be pretty overwhelming to say, how do I get started? And so we look at a couple of different aspects on how to develop an exercise routine. Certainly, we want to prevent injury. It's no fun to cause an injury. So how do we look at that? We talk about exercise phases, understanding those, and then understanding the parameters that go into exercise. So first of all, just to mention the different phases, being acclimation, improvement, and maintenance. So just as with starting anything, there is a period of adjustment. With exercise, this tends to be the toughest phase. That's where the highest burnout is. This is where people are really putting in some work, and it can be pretty difficult to get started. We'll talk about ways to make that easier and to make you feel empowered on how to do that. Then you start to notice that improvement. There's going to be predictable benefits in self-efficacy, fitness, and mood. It becomes easier and easier. That stage lasts for weeks to months, and then eventually it's that maintenance phase where this is just part of your routine. You continue to develop physical adaptations that help you improve exercise tolerance and overall health. Sometimes you make adjustments to those exercises, but a lot of people can't stop, won't stop at this part, and this continues indefinitely. So again, talking about that initial acclimation, this can be a very tough phase for starting an exercise routine, and it can last weeks because it is tough because it puts new and additional stress on the body, and that's physiologically challenging. Again, because it's tough, this is where people tend to drop out the most. It's hard. It's like that New Year's resolution. You do it for a couple of weeks and then kind of give up on it. But pushing through this phase, that's really where you can then get a lot of those more long-term improvements. So what's the easiest way to kind of look at this? How do you get started? Really just commit to the frequency first. So saying, hey, I'm going to exercise frequently. So 3 to 5 days a week. I'm not going to make it hard. I'm not going to do it for a long time. It's not going to be high intensity, but I'm going to decide I'm going to go for a walk around the block 3 days a week. That's not hard. It doesn't take a lot of time, but I'm at least doing something with some frequency. And then stick with it. It's definitely going to get easier the longer that you do it. When we talk about exercise types, so any movement or increased physical activity for self-betterment is exercise. Really just getting out there. How do you decide what type of exercise you want to do? I know I mentioned walking frequently. Everybody walks. That's an easy one to kind of talk about. But deciding on what type of exercise you're going to incorporate at that frequency really should be tailored to your personal goals and your medical history. Whether you want to improve strength or endurance or lose weight or just enjoy some time with friends or family. And then obviously medical history, surgeries, injuries, and other medical restrictions. There might be some exercises that aren't right for you you based upon your medical history. So deciding, it's not a one size fits all. So it certainly is saying, what is the best exercise type for me? How can I start doing that at a very easy pace, easy time frame, but just getting it done kind of a couple times a week, trying to get that frequency aspect down. And then really those types of opportunities are immense. You can see that this slide is very, very busy. The reason it is because there are almost an unlimited amount of types of exercises that can be done, that can be enjoyed. And again, it all depends on what you enjoy doing, what fits your personal goals. And again, going back to those kind of exercise barriers, you might not have access to, a skating rink. So skating might not be the exercise that you do, but there certainly are an immense amount of invariable opportunities that there should be something somewhere out there that can get you moving. And again, how to start with that, again, so you say, okay, I think I could do this 3 times a week, and I think I might like doing that, but really, how do I get going? Find a friend to exercise with, pick an activity. If you don't know where to start, try a class at a gym, ask the guidance of a trainer, ask the guidance of your doctor. There's a ton of adult recreation leagues. We see those all over Indianapolis, and then even just getting outside. I mean, Indy's got a great place to be outside, to be active, and tons of opportunities here and all around the state. So there's plenty of places, plenty of resources out there to help give you some guidance if you just aren't even sure where to begin. So we talk about the frequency. So how often should we do it? So any frequency is really beneficial. And again, even if that's just 10 minutes a day, as long as you're doing it, that's beneficial to you. The more frequent that you exercise, the more benefit you get. And then we talk about length. How long should I exercise when I do exercise? Again, any duration, 10 minutes is enough to really get benefit. But the longer that you exercise generally does increase benefits. You certainly can exercise too long of a duration can certainly lead to injury, and we're going to talk about how to avoid that here later in the presentation. But some really pretty common stuff, and you can see here on the slide, easy ways to build it up, doing 15 minutes 3 times a week. Maybe you bump that up. You can get all the way up to an hour 3 times a week or an hour 5 times a week. But really what the American Academy of Family Physicians and the American Heart Association or Heart Society recommends is getting somewhere around 150 minutes of moderate intensity exercise per week or 75 minutes of high intensity exercise per week. And again, that's not something where we say if you're not exercising, go straight to that. That can lead to injury. We'll talk about that. But building up to it, again, by just increasing frequency first and then duration or intensity. And so let's talk about how we build up, how we understand the workload we're putting on our body and how we prevent injury from that standpoint. So we can look at exercise workload as, equivalent to the amount of physical stress that you put on your body. Now, there are multiple parameters to exercising. Again, we talked about frequency. That's how often are you doing it? Then there's time. When you are exercising, how long are you exercising for? And then there's intensity. When you are exercising, how intense are you exercising? Are you going all out or are you just taking it easy? And all of those contribute to exercise workload. What you want to do is, like I said, you don't want to just start off and say, okay, the American Heart Association says exercise at 75 minutes of high intensity a week, so I'm just going to start there. That's probably going to lead to injury. You want to increase one parameter at a time, and you don't want to increase any parameter by more than really 20% per week or exercise phase. So it really is about slowly building it up, and that's really a way to kind of ease into and develop an exercise plan. And even if you already have an exercise routine and you just want to improve on that exercise routine or increase that exercise routine, this is also still an important principle for avoiding injury and really ensuring kind of longevity in your exercise routine. So really kind of think about that workload and make sure you're not overdoing it, because that's one way to cut those routines short and really kind of lose a lot of motivation. If you're constantly injured, exercise becomes a lot less fun. So then again, we talk about this. Start with frequency. Just commit to doing something, anything for any amount of time. Just do it kind of when you can, and try and do it frequently, you know. Then once you are doing things frequently, you're like, hey, I've actually been able to carve out, three times a week. I'm able to get and do something. Now you're kind of say, oh, can I do that for a longer time? Or if I can't do that for a longer time, do I just increase the intensity? Do I change up the activity? And see where I get with that. And again, big thing to prevent injury, just don't go too fast, too quickly. Don't increase multiple parameters at once. Just take it slow and build that body up. Don't break it down. How do we judge intensity? And so the truth is that intensity is relative. A lot of people equate heart rate to intensity, and that is true. But not everybody's heart rate is going to be the same doing the same activity. We all know, it's well documented, that well-conditioned athletes have very low resting heart rates. And so for somebody, an Olympic track athlete to run a mile, they, at a pace of 8-minute mile, their heart rate might only get up to 120, whereas for some of us, it might get up to 160. And so that's why this intent, and that's not that they're doing, higher intensity, you're doing lower intensity. That's what we mean by intensity is relative. So we kind of judge it by exertion, judge it by heart rate. Low intensity exercises is where you're going to be getting moving, getting the blood pumping. But typically we say you can probably carry on a conversation. Like you can walk and carry on a conversation, but you know that you're moving. That's kind of low intensity exercise. Moderate intensity is going to be more constant, increased effort. You can usually still talk in sentences, but probably needing a breath. You're probably not just going on and on and on like I am right now. So I would not call what I'm doing moderate intensity exercise. I'd have to take more breaths. And then that high intensity exercise really is more vigorous and pretty substantial effort. You certainly can get some words out, but you're really not carrying on a conversation. That's kind of heavy breathing. So I think that's a good way to kind of judge where your intensity is at. And that will correlate well to heart rate. But again, heart rate is going to be a moving target in between individuals. We're not all going to have the same heart rate moving at the same speed, and for multiple reasons. So let's then get into exercise and injuries. So injuries can be acute or chronic. They can result because of extrinsic factors. Those are the things outside of us, like equipment, surfaces, or even other individuals if we're playing in a kind of a group setting or a group activity. And then there are intrinsic factors, things like prior injury. Do we have some impaired function and motion? Do we have some limitations in flexibility or strength? And then a lot of times these injuries occur because of overreaching or overtraining. So trying something that the body's just not really conditioned for. Now we talk about acute or chronic injuries. So acute injury causes can occur again because of direct trauma, so contact or collision activities. Sprain, contusions, lacerations, or fractures. Those are some of the common things that we hear about with kind of a trauma or acute kind of injury. And then there's also acute overload. So this is when we're going to be exceeding that strength of the tendon, muscle, or ligament. Sometimes this occurs because of overreaching. We want to try something that we haven't done before, and we might not be prepared for it or appropriately conditioned for it. So we might kind of cause that muscle strain, or we might roll our ankle, or cause an acute kind of tendonitis, inflame that tendon just by pushing it too fast, too hard. Again, that's why we recommend really being slow and progressive, methodical with the progression of your exercise routine. So how do we prevent these acute injuries? Again, obviously, general readiness is important, making sure you're supporting your general health with sleep, hydration, and nutrition. And then in reducing those intrinsic risks. So warm those muscles up, get them activated, do some dynamic stretching. That's kind of the, swinging the legs, the arms. You're not doing it hard, but just getting the body moving so that it's not so stiff when you get started. Understanding the correct mechanics or motion pattern for an activity. Again, that's why it's important to kind of gradually progress into new activities, maybe learn a little bit about it before you really jump right into it. And then avoiding overreaching, setting and adhering to realistic goals, knowing what you're capable of, knowing what your goals are and what you'd like to achieve, but not overreaching for those. And then reducing extrinsic factors or extrinsic risks.
Really, this is one of the big things. It's like understanding the equipment that you're using. We've all seen somebody at the gym and you're like, I'm not quite sure they're doing that one right. Those are, and you're like, they might get injured. Sometimes that is what happens. And then if you are participating in a new group activity, a new sport, kind of understanding the rules so that those rules, for sports are really there for safety and some for fair play, but a lot of them are important for safety. And so understanding how to play a sport, how to interact with folks is important in reducing that extrinsic risk. And then we talk about chronic injuries. This can be something where it's really chronic overload. So you're repetitively stressing the body, causing tissue breakdown. Now that's how we build muscle. We cause a little muscle breakdown and then it rebuilds stronger than before. But it's very easy if you're not doing the appropriate kind of, if you're consistently overreaching or not doing the appropriate recovery, that you can result in tissue breakdown greater than the tissue recovery. And so this can be progressive and very body part specific pain. These are things that people hear of, such as stress fractures or chronic tendon issues, tendon degeneration. This can lead to arthritis as well in older individuals. And then there's this concept of the overtraining syndrome. And this is just excessive physical activity without enough time for rest or recovery. People start to feel fatigued. They have decreased performance. They get depressed. It just becomes this kind of cycle where I feel like I'm moving, I'm exercising, but I'm not getting the improvements that I thought. I'm just kind of feeling worse. And again, this is just depleting the body of all of those natural things that are meant to build it back up, and just continuously breaking it down, tipping the scales to break down over building up. So how do we do that? How do we prevent? Again, I'm going to sound like a broken record here, but really slowly progressing an exercise routine. Don't get too rapid increase in any parameter. Really be mindful of how you're progressing your exercise and your activity. And then doing the general support, getting the good sleep, getting the good nutrition, getting the good hydration. I think you guys are having a talk or already had a talk on some of that importance of the nutrition and the hydration in recovery and supporting the body. But sleep is incredibly important as well. And then recovery, like I said, allowing your body that chance. So taking rest days, like I said, you saw what the recommendations were, where they're not saying exercise 90 minutes, 7 days a week. That's not good for anybody. Taking rest days and doing some cross training. You don't want to wear yourself out. Like the Knicks did. You want to stay up and be strong. So how do you manage injury? You gotta first recognize it, right? So there's a difference between muscle soreness and a true injury. So you got to be able to recognize those injuries. Again, resting is important. There's a concept in acute injury we call RICE, which is rest, ice, compression, and elevation. These are very simple things to do at home. You rest the body part, you put some ice on it. Compression, like with an ACE wrap, or just some kind of a compressive sleeve. A lot of people wear knee sleeves, elbow sleeves, ankle sleeves. And then elevating that thing, keeping it above the heart, letting it kind of drain out, so it's not so swollen, not so inflamed. And then a big thing, modifying that workload. We talked about that workload and how it is really important for injury prevention, but also very important for injury management. So performing some cross training, like I said, if that body part's hurt, do a different exercise, rest that body part, do something else, or just rest completely, or modify that exercise. Just trying to relieve some of the stress on that injured part. So other ways to manage injury if you feel like you're not getting it yourself. There is a lot of physical therapy here in the state of Indiana allows direct access. So you can start directly with a physical therapist, or a chiropractor, obviously accessing those folks directly, even without consulting a doctor. That said, go ahead and do consult your doctor, consult your orthopedic doctor, or consult one of us, a sports medicine specialist. Again, we people think, oh, well, I don't play sports, or I'm not an athlete, I can't see a sports medicine doctor. I already told you, an athlete is anybody who participates in physical activity for self-betterment. So if you're doing any kind of physical activity because you enjoy it or want to be better, then you are an athlete in my mind. But we treat everything. We have full spectrum treating kids to adults. And so come see us if you have any questions or concerns. But again, lots of ways to manage that injury. And the biggest thing is just being diligent and smart about how you approach your exercise routine in the first place. Not increasing any parameters too quickly, and not overreaching, making sure that you're familiar with the exercise equipment that you're participating in or the sport that you're participating in. And setting realistic and achievable goals so that you continue to have fun with it. And then hopefully we all get to this phase of exercise maintenance where we continue to make exercise a part of our daily routine, our weekly routine. Sometimes you mix it up. You've been doing one exercise for the past 5 years and you say, I'm tired of that. And so adjustments are a natural part of an exercise routine. And your goals might change over time, whether it should still be self-betterment, but other things might come in, like I said, Rocky was one of my heroes back in the day, but sometimes, heroes kind of change over time. So, you might kind of switch it up a little bit too. So, but the goal is to get all of those health benefits from being active. So that's my presentation. Thank you all for being participants and hanging out here this afternoon. Let's see if we've got any questions here. I'm not sure how to do that. So I'm going to stop sharing, but I can come back on. All right, here's Q&A. Yeah, so somebody asked about a brand or a type of shoe for walking to avoid plantar fasciitis or other injuries. So I'll tell you, everybody's foot is a little bit different. Some of us have really high arches. Some of us have very low arches. And all of our gait mechanics are just slightly different because of that. So typically we say a one size or one shoe does not fit all. So it really depends on kind of what works best with your foot. I think if you have a very high arch, we generally recommend a well-cushioned shoe. Those are the types of shoes I think you see, like the On Clouds, the Hokas, that have a very large kind of cushion on the bottom. I think those are very good for folks like that. If you have a really flat arch, then actually having some arch support is a little bit more important as well. My general recommendation is that I would try on some shoes, and whatever is the most comfortable for you actually is the best one. And that's actually well supported by studies performed within the armed forces. They took all these armed forces guys and gave them a bunch of different types of shoe, and what they found out is that whichever one they liked best was the one that worked best for them. Whichever was most comfortable is what worked best and prevented the most injuries. That said, if you're dealing with things like plantar fasciitis, calf stretches are very important. Flexibility is really key. So looking at that whole functional aspect. Again, we talk about the intrinsic and extrinsic things that can lead to injury or can lead to improvements. Shoes being an extrinsic factor, certainly, as well as surface that you're participating on as an extrinsic factor. But we got to make sure we also look at those intrinsic factors. Is my calf way too tight? Is my foot, am I not strong in my foot? Do I need to be doing, some other types of exercises? Or do I need to strengthen my glutes? Or is that going to help me with my exercise routine? So again, looking at extrinsic and intrinsic factors. That was the only question I saw, so I'm happy to chat with more folks.
I think we did have one more that just came in the chat, it looks like. It says, how can you encourage others to exercise?
Yeah, so, a big thing is talking. Everybody's heard about those benefits, right? It's simple to say, hey, listen, exercise prevents all-cause mortality and early death. That, to me, that's a motivator, but you got to, and talk about, all of those benefits, all the things it prevents, all the things it promotes. We talked about going through those excuses and saying, hey, so trying to identify the barrier that person has to exercise. Is it fatigue? Is it financial? Is it a convenience thing? Identifying what are the specific reasons that they're not interested in exercise, trying to address those, and trying to make it fun, trying to see not only what are the barriers, but what is this person's goals, and how can we motivate them towards those goals through exercise. Like I said, it's tough. Everybody has different reasons for wanting to exercise. Everybody has different reasons for not wanting to exercise. I find that the people that stick with an exercise routine, the motivation is more kind of personal, intrinsic, in the sense that I want to be a better person. I want to do all these things. I'm not just doing it because people have told me it's the right thing to do. So I think trying to get them to find that motivation is important as well. But it's tough. Everybody's got different reasons, so I think you got to kind of look at those. Yeah.
I think we did have one other question as well. It says, I have arthritis in my knees, and I find that when I start to exercise routines again and again, the pain and inflammation gets worse, and I need to rest for an extended period of time before I can start again. What do you recommend for starting and being able to maintain a consistent exercise routine? They feel fairly comfortable with walking, but would like to do more for exercise than just walking. They're concerned because they're only 32 with arthritis, and from their understanding, it doesn't get really better over time.
Right. Yeah. So, I mean, that is a young age to kind of start with developing some arthritis. Making sure getting that frequency down first, that's important. It sounds like you're a motivated individual to exercise. A lot of times with arthritic types of pain and inflammation, we talk about less impact activities. So walking is minimal impact. Things like running tend to be higher impact, and that's going to contribute to more arthritis, especially in the knees. The knees are a weight-bearing joint, and so any of that kind of repetitive impact really does kind of cause further wear and tear. So things that are non-impact activities. Biking tends to be a little bit easier. I find that a lot of people with arthritis do very well with aquatic exercise. You're in a kind of a lower weight environment, so you're not putting as much weight, especially on the knees, again, a weight-bearing joint, and still able to build strength and build flexibility and motion that way. So I think aquatic exercise is very good. And then relying on some of the additional things, I'm certainly not a med pusher or someone for injections. And at 32, I wouldn't recommend starting, steroid injections all the time. That would not be super beneficial. But looking at some of those things, the icing after activity, using a little anti-inflammatory, whether that's a topical anti-inflammatory or an oral anti-inflammatory, and kind of just looking at all of those different parameters. How can I exercise without, really irritating the knee over too much? But for OA, the keys are lower impact activities. And so like aquatic stuff, biking is certainly better than running or a treadmill. Just building up good strength over, that impact is important. So, but it's tough. But yeah, when you start to develop some of these arthritic changes, especially earlier on, it can be a challenge.
All right, we did have a couple more questions in the chat come in. What is a good plan or options for someone who states they have bursitis, knee from walking?
Yeah, again, so bursitis is going to be a kind of inflammation that occurs, within that knee joint from activity. Again, icing, I think after activity is key. Anti-inflammatories can be beneficial, but typically, if there's a recurrent bursitis, I mean, our knees are for walking, are for weight bearing. So I would also again identify what are some of those intrinsic factors that could be contributing. Are they overloading the knee because they're not activating their glute muscles or their hip or butt muscles as much? So sometimes looking at kind of more functional tests can give us a key, and that's what we do here very frequently. But just as far as treating that, it is an inflammatory type of condition, so treating it with ice is an anti-inflammatory, and any other anti-inflammatory medications. But I'd say most of the times when I see some bursitis, now I will be honest, there's there are things that I don't see and things that, like, I'm not the smartest person in the world. So there could be some anatomic or structural causes for some of these conditions. But I frequently see bursitis, there's some kind of something in the chain somewhere that can be improved to help relieve some of the pressure that goes directly through the knee.
All right, we have one in the Q&A, it looks like.
I will say another thing is in other activities, again, walking is a impact activity. So there might be other activities, again, if there's a predisposing cause for the knee bursitis, other activities that may feel more comfortable exercising with. Again, I think aquatic exercise is really good for people who are having weight-bearing knee pain.
Absolutely. Another person said they often find muscle soreness fades if they follow the advice of keep moving rather than pain equals need to rest. What's the balance between these two approaches, would you say?
Yeah, so it kind of goes back to my point where, like, you have to be able to identify injury, and that can be tough because there can be a subtle difference between muscle soreness and a true injury, right? And so I agree, if your muscle is a little sore, it is good. It's good to keep it moving. And that's part of the recovery too. If you exercise a muscle, you should stretch it out. That stretching is probably going to feel a little tight, but you're right, moving through some of that tightness, moving through some of that soreness helps with that recovery. And so it can be subtle, the difference between muscle soreness and injury. I'd say a lot of times with injury, there are going to be some external factors that you see. Sometimes it's going to be obvious, right? Like you rolled your ankle and now it is incredibly swollen and purple and bruised. You probably shouldn't, push on or move through a tissue that is bruised. That type of stuff. So it can be, you have to kind of pay attention to how you feel. And typically what I would say is if you're uncertain, start with very, very low stress movements and see how it feels. So if you're saying, okay, is my knee just sore from muscles or is my knee actually injured? Maybe just do a couple of body weight squats and see how it feels. If it starts to loosen up after 2 or 3, maybe that's just some soreness. But if you're really having sharp pain, you really shouldn't be pushing through those types of things.
What would you say are the pros and cons of running on a treadmill versus walking at incline?
Yeah, so both. So walking at incline is obviously going to be a little bit tougher than walking at a flat plane because you're going to have increased forces pushing you up. So you're doing more work, and so that's going to be a higher intensity exercise if you're doing it at the same speed. I guess is the so. They're both going to be beneficial. It just depends on what you enjoy. I would say there's going to be greater impact with running because you really are lifting off the ground more. You're getting some up and down movement. So there's going to be greater impact on your body with running than with walking generally. But walking on an incline certainly is going to make that walking a little bit more difficult than just walking at a flat pace. The truth is, it's whatever exercise you guys enjoy. And they're both, and running and walking are going to be engaging similar muscle groups. Again, because of the more up and down movement with running, as you do actually kind of leave the ground for a moment, higher impacts, but it also engages more things like more of your core and more of your glutes than just walking does. But if you're looking for cardiorespiratory fitness, I think you can easily match, where you're at running, as well as so if you're looking at cardiorespiratory and weight loss, you can easily match what you're getting running as walking at an incline at a higher intensity. Yeah, it's about intensity there, really. Am I getting to that level where I'm out of breath? Kind of thing.
We did have someone mention that they've had hip and back pain for a year. They're currently doing P90X, but they're wondering, how do they modify if to help maintain their strength and improve my weak core? They said it's hard to do sit-ups at the moment, for an example.
Yeah, so there are other exercises that can kind of help improve core. If it's the motion across the back and the hips that really bother you, sometimes doing more what we say, so that's
we can break down exercises into like dynamic and static and aerobic and anaerobic types of exercises. A lot of times dynamic stuff can be a little bit more uncomfortable depending on some of the underlying things that are going on. So like a sit-up, you're moving, that's dynamic. A plank, if you're just, sitting there and engaging your core and then relaxing or doing, either laying down, doing a plank, a glute bridge, those kind of more static exercises tend to be a little bit better tolerated, I think, and then really can help you build up some of that strength or maintain that strength, while the rest of those things can calm down. Or if doing those kind of more static, less dynamic, less high resistance type of exercises. So we talk about if it's painful to do something, let's be slow and more controlled with it. Or how do we engage those muscles without even making them having to move a whole lot? And so I think if planks are a great way to build core strength that don't require a ton of dynamic movement through the hips and the low back. I can do it. I would recommend, if your back's bothering you, if you're doing a plank, try and keep your back a little bit more arched initially. That'll be a little more comfortable than letting it sag down. That might put a little bit more pressure, especially if it's kind of SI joint, sacrum, low back type stuff.
Awesome. Another participant had said that they had read from a number of sources, once you reach a certain age, doing weight training is more beneficial than doing intense cardio, but they find weight training boring. What are any tips that you would have to help make weight training more interesting for them?
Yeah, I think so. Keeping it varied, and I would say keeping exercise varied generally throughout. Throughout your life, there are certainly age-related cardiovascular changes and changes in how muscles kind of build and things like that. As testosterone or estrogen fade over time, there are certain physiologic changes that occur that exercise will not always have the same benefit. But as far as keeping things interesting and motivated there's a ton of different resistance activities out there. I would just, I'd go down the line at the gym and say, let's try out this machine, see if I enjoy it, if it's fun. You can, and even setting goals, or again, joining like a club or an exercise routine or a resistance training class. They have lots of classes that'll be about, resistance. And so there's lots of ways to kind of mix it up, and different resources out there. So like you can join a class that says, hey, we're going to be doing some lightweight lifting, or try a machine you haven't tried. Again, to prevent injury, make sure you know how that machine works. Read the instructions first. But I think and for me, it's just keeping it varied. Trying things out. If something looks more fun, try that. And sometimes setting goals, I think, is a fun way to do it. Say, hey, listen, I'm not really motivated to do this day in, day out, but if I set this goal for 3-4 weeks from now and say, hey, could I get to that level? Is that something that's possible? Sometimes that keeps people a little bit more motivated.
Awesome. And we did have one last question in the Q&A. For those that are using a standing desk throughout the day, what percentage do you recommend they should be standing versus sitting?
Yeah, I think that's it's probably a little moving target. Again, I think there's lots of personal considerations, right? Like medical history, what your goals are, and stuff like that. I think that the human body is pretty capable of standing for a very prolonged period of time. So, as I'd honestly say, just as you're comfortable. It's reasonable to take a break. If you're starting to feel a little bit of stiffness, have a seat. I know a lot of people that have standing desks will get like these little like mats that have like different types of like things that they can put their heel on, and that just keeps their legs moving. So you're not just engaging the same muscle group, like you're not just sitting there locked with your glutes or your low back, but as you kind of shift your weight on your feet a little bit, that can ease up some tension in certain areas and engage in other muscles. But again, it really depends. Like I don't know your medical history, what your goals are, I think play a big role in really how much you should be doing that. But I do think that whatever you're comfortable doing and finding other ways to kind of keep it comfortable, I think is a reasonable kind of way to approach it. I don't see any reason to say you can't stand all day as long as you're comfortable doing that. So.
Awesome. Well, Dr. Richardville, thank you so much for sharing such great information today about today's topic, injury prevention and building an exercise plan. To all the attendees, I want to thank you all for joining us for today's health and wellness webinar. Your attendance today will also earn you team points for Corporate Challenge as well. And thanks to our title sponsor, Elevance Health. If you enjoyed today's virtual programming, we have plenty more ahead. Our virtual challenge begins June 9th and will run until June 19th. We'll send more information about how to participate in the movement challenge, but it will be conducted using the same Run sign up website that you use to sign up for Corporate Challenge. Our next piece of virtual programming will take place next Tuesday at noon as we continue our virtual yoga series. I'll drop that link in the chat now so you can register if you'd like to participate. I hope you all can make it. Thanks again. Have a great afternoon, everyone, and go Pacers.
Yes, sirs. Thank you.